Hi, my name is Anastasia. I'm the physical therapist here at Movement Physical Therapy. I had a question actually with the new technology of ChatGPT coming out. I was curious as to how good is it? So I posed just a regular question saying, hey, if I'm just a regular person off the street, what are some suggestions do you have if I'm having lower back pain? And it actually had some good things. It says exercises, heat or cold therapy, improving my posture, pain medications, massage therapy, and at the bottom of the list, physical therapy and chiropractic care. And it, of course, had a disclaimer saying, hey, you should do this at the discretion of medical advice. If you have more questions, please go in and seek more help. And then I was curious to say, like, okay, well, if I don't want to go into the office, what else can I do? So I asked it, hey, well, which exercises can I do to help my lower back pain? And it came up with some good answers, some general PT stuff that you would find in the clinic and what you would find on the internet to say these are good exercises for your back. First one being knee to chest stretching, stretching your hamstrings, cat-cow exercises, pelvic tilts, leg raises, although it did mislabel it incorrectly, and some lower back rotations. And these are some general answers that you would find on the internet or at general PT. And then I was curious, since I have a more medical background, I asked it, well, why are these exercises good for lower back pain? And if you watch the video, you can see that there is a very long time before it answered that question compared to the previous two questions that I asked it. As you can see, ChatGPT takes quite a while to actually answer that question, and it's slow in typing its response. But the response that it gives is that the exercises can alleviate low back pain with stretching out the muscles, strengthening the back, the pelvis, and the hips. It also increases circulation, it alleviates the pressure on the lower back, and helps to improve your posture. All good things, all that you would find generally on the internet. Well, I posed it a second question, and this question requires more of an understanding of what the anatomy is. So you need a more scientific background, and this is kind of where it gets a little hairy. I asked it, well, will these exercises that you've given me, will they help or will they harm in case I have a herniated disc, which is a very common cause of lower back pain? And it said yes and no, depending on the exercise. But it wasn't very specific. But it generally said these are safe if you do gentle stretching, some strengthening of the back, the hips, and the core, and some aerobic exercises. But it didn't really go into depth of like which exercises are good or which exercises would be possible to do. It had labeled generally safe exercises as gentle stretching, strengthening your lower back, your hips and your core and aerobic exercise, but it didn't give any specifics of like, you can look at this link or here's a list of what I mean. And that's kind of what I was looking for. But it did give a better list of what exercises to avoid. It said avoid anything that twists or bends, avoid any high impact exercises, and to avoid anything that puts a lot of pressure on the lower back. And of course, it had the disclaimer at the bottom, again, consult your doctor if you have any more questions for further information, blah, blah, blah. But it didn't really give me a good understanding of what exercises I can actually do to fix my lower back pain. And afterwards, I asked it, well, will the Mackenzie method help a herniated disc? And that's the method that I use to treat my patients for the most part. And it kind of just spat out a big answer. But the answer was yes. The Mackenzie method can help a herniated disc. And then I was curious, diving further into anatomy, I asked, well, is there evidence that physical therapy can help a herniated disc? Is there an MRI that shows the disc pre and post physical therapy? And it said that not necessarily that physical therapy will fix the herniated disc, in quotation marks, but the goal of physical therapy is to help the symptoms that you're having. And also the disc material may resolve on its own. It may stay herniated and you just no longer have symptoms per the MRI, or the disc material may be reabsorbed and you heal on your own within 8 months, I think is what the research had shown before. So moving on, I further asked ChatGPT to show me and explain what the Mackenzie method disc model is, because this is a very important part of the education that I provide for my patients. And I like using a lot of understandable terminology and pictures and diagrams to really help patients understand what we're covering. But ChatGPT really gave a very generic, off the website response, which is fine if you understand what it's talking about. But it's hard for somebody to understand that doesn't have a good grasp of anatomy or what could be causing the pain. So what's my conclusion with using ChatGPT to help with understanding how to use it? And basically, ChatGPT is as good as the questions you ask it. So that also puts more on you to know what you're asking it. But it also is just giving you information off the internet. So it can't be as specific as, let's say, you go into the office and ask a professional for care. If you come to physical therapy, I can give you exercises in a list that say, hey, you do this every day for so many times a day, and we should see your back pain turn around. ChatGPT did not give you that. You still have to go see a specialist to get a specific list of exercises for you to do that is correct for your pain.